Hello everyone, Dr. Demchenko here. Today I'll tell you what to do for a sprained ankle. Of course, first of all, when the situation is acute, when you can even see a hematoma in the area of the swelling. You need to go to the trauma center, get an X-ray, check if you have a ligament tear, a complete or a bone fracture. After this, it is necessary to take emergency medical action, that is to cool the area, raise the leg above the head while lying down, apply a tight pressure bandage, and after this, move on to, let's say, a more subacute phase in a few days. And the problem is that very often when the swelling goes down, when the main pain from the tear of the ligaments passes, and it would seem the situation should be getting better, but there is still pain when walking. And today I wanted to talk specifically about such cases when the ankle is poorly treated and hurts for a long time after a sprain. Why does this happen? Most often this happens because during a sprain, the bones in the ankle joint shift, and this shift interferes with the normal functioning of the joint. Most often this is pain when walking on the front surface of the ankle joint. To check if you have such a shift that prevents you from walking, running, and jumping normally, you can perform a fairly simple test near the wall. To perform the ankle joint flexibility test, we will need a ruler and a plaster. We mark 10 centimeters from the wall and make a small note. Next, place your healthy foot on the mark and, without lifting your heel, reach your knee to the wall. Normally, you should be able to easily reach and feel a slight stretch on the back surface of your shin. Next, place your sore foot on the same mark and try to reach. If you feel a limitation or pain on the front surface of the knee joint here or here, it is highly likely that this is a joint problem. And if you do the following exercise, your walking pain will decrease or disappear. If you got a positive result on the test, then there is pain in the front area of the ankle when bending, we can try to perform such a procedure. It is absolutely painless and safe. In most cases, it can help you well from pain. How is it conducted? Since the most common problems are displacement of the ankle bones, there will be a displacement of the head of the small tibia forward. Accordingly, the procedure that relieves pain will be an attempt to mobilize it in the opposite direction. How to do this? Tension. We set this part of the brush on the head of the small tibia. We grab the fifth bone with our fingers. Then we make a compressive movement with our hand. Light about 1.5 to 2 kg, just like that. This should not be painful and should be quite comfortable. We squeeze a little, and holding this squeeze, we will move the knee forward and bend the ankle. If you did everything correctly, then the bending of the ankle should go easier, and the pain should decrease. How do I perform this on myself? We place the tensor on the head of the small bone in such a way that it clings to it, not the entire ankle. We secure it with the tensor. Second moment, we lay our fingers on the metacarpal bone. That's how we grip it. The third stage, we include the hand to slightly mobilize the bone backwards. And we start doing the movement of bending the ankle. Repeat 10 to 12 movements. 2 to 3 approaches per day. After such a self-mobilization approach, be sure to check if the bending has improved, if the pain has decreased on the first wall test. Normally, after the first approach, you should already have a few centimeters added to the bend and the pain should decrease. Also, a very good sign will be the transition of pain from the front of the ankle to an even stretch on the back surface of the calf. Perform such exercises 2 to 3 times a day, 10 to 15 repetitions over 2 to 3 days. Sometimes they need to be performed over a week. I hope the pain in your knee will go away. A good mood will come. Until new meetings, everyone. Bye.